This video explains how a healthcare provider or a doctor can log in through the platform, can consult the patient, can provide e-digital prescriptions, and fill in assessments or collect vitals of the patient. Specifically, this video will help you understand about antenatal assessments, how you can share them, antenatal care plans, etc. So let's just log in now. This is the user ID for the doctor and password, which I have already entered. I'll click on login. Once I log in, we can see all the other locations I have access to, as in if an organization has multiple units or centers, we can give multiple centers access and the doctor can select one of the profile. Once I click on it, we'll go to the OPD work list. Now this is the work list of the doctor, where they can see the scheduled, completed and cancelled consultations. In scheduled list, we can see patients details like their name, age, gender, UHID, mobile number, etc. And in we can also see the scheduled time of the consultation. Now as we go ahead, we can see some action buttons over here, like vitals, assessment, consult button. So let's start with collecting the vitals. Now this can also be done by other healthcare workers, but right now I'll show that doctors also has an access to it, so they can also collect the vitals if at all it is required. So we'll just add some vitals. Again, these vitals are completely customizable, so or you can add multiple other vitals over here. Save it. Once we save the vitals over here, it will get added to the patient's record. Now we'll click on assessments to fill in the assessment form. So these are all the assessment list over here. You can select one of the assessment form, either fill by yourself, or you can send it to the patient so that patient can fill it by themselves, or you can send patient education form if at all you want to send any. So we, as you can see in the first line itself, we have antenatal forms. So again, we have mentioned over here in multilingual manner that if at all there is an antenatal form but you want it in Marathi as well, if at all you want it in Kannada, if at all it's just English or any other language, we can create it over here. So let's open up this form over here, antenatal. Once you click on fill, this is how the form will look like. Again, this form is completely configurable, can be created in many ways, or many templates as required. So this is the antenatal care form, so they can fill in the data over here. So we'll just look around what all things are there over here. So there is scoring, there is examination, there is antenatal visit. So according to that, they can add in complaints, they can add in whether their screening was done or not, or their ultrasonography was done or not, etc. And you can submit the form. Once you submit the form, this is how the response will get recorded over here. Now anytime you can click on this response and view it, or else there is a place called patient journey, where all of the things that are done for the patient gets recorded. So we'll get on to that point once we finish this. So just to let you know that this is the assessments section, where you can select any assessment form and send it to the patient directly to their WhatsApp number, to their registered number, or else you can fill it over here, or else you can print the form, you can give a hard copy to the patient and you can upload it to this section. So now let's go ahead with consult. Once I click on consult, this is how the screen will look like for the consultation. Now here you can add diagnosis for the patient. Now because this is working diagnosis, the previous diagnosis are getting recorded. So you can add, the doctor can add working diagnosis over here, can add special instructions, can add chief complaints, can suggest investigations, follow-ups, etc. Now as I said, that patient journey and the vitals and everything rest other things, all the things are getting recorded for the patient. So we'll just see, this is the patient journey where you can see we just now filled antenatal form for this patient, that is getting recorded. Doctor can click on it and open that form and view what all things have been filled. Now also the vitals are getting recorded. As you can see, we just now recorded these vitals over here, so these are also getting recorded in a tabular format. Also it can be viewed in a graphical format over here, so it can be of week, of month, or a year, so you can have a consolidated report of all the vitals that have been till now collected. Now once we get down, we can see the care plan. Now this is care plan that is getting auto triggered. Currently the care plan is antenatal visit 3. All of the again fields are configurable. You can fill in the data that you get from the patient, that is if there are any complaints, how are the fetal movements, what is the weight, then fetal heart sound, then CBC, then treatments or immunization if at all the patient is taking anything, then health education if they are exercising, if there are any severe things to be looked into, and then they can add in their own signature. The doctors can add their own signature over here. Now once the care plan is filled, they can add other notes if at all there are any notes that needs to be mentioned. Then they can add medicines over here for this patient. For example, we have already entered few of the medicines like folic acid or iron medicines, etc. So all of these things are already added. They can click on this and search for the medicines and click on it and add the frequency, days, instructions, etc. Similarly, the lab investigations can also be added over here. Now for the follow-up, if at all you want to mention the next follow-up date or next appointment, you can mention the number of days over here, like after 7 days again there will be one more appointment. This lead will be generated and someone from your team can call the patient and take the confirmation whether they are going to visit or not. So similarly, their allergies can be added over here. Again, these allergies get saved, so you don't have to add it again and again. But if at all there are any new allergies, you can type in over here. For example, pollen allergy. Now once all of these things are added, they can either print or send or complete the consultation. And there's one more option called as cross consultation, where if at all any second opinion is required, you can ask it to any other doctor and initiate the cross consultation. Now there's one more option called as order button. In this order, what will happen is that this order will be directly sent to your pharmacy or to your lab department. And if at all any other assessments are required to be filled, there is a shortcut over here, this short button. You can click on this and you can fill in any other assessments that you want to. Or there is a care plan option. If at all you don't want the 24th week care plan over here, you can trigger the 30 32 week care plan over here. Again, you can fill in this care plan and share the data with the patient. Now, once all of these things are added, we can click on complete. Once I click on complete, I'll get a preview of the prescription that is going to be sent to the patient's WhatsApp number. So as you can see, we have patient's details, we have doctor's details, we have diagnosis that is mentioned, we have vitals over here, then consultation notes, then suggested investigation, medication, next follow-up date, and doctor's signature. All of these things are getting printed over here. Either you can directly print and give a hard copy to the patient, or once you click on yes, this PDF will be directly sent to patient's WhatsApp number. Once the consultation is completed, it moves to the completed list over here. As you can see, again, if you want to review the prescription, you can click on prescription and you can see what all things have been added for this patient. Thank you.